morning, everyone, and welcome to today's webinar presentation, Innovative P.I.P.E Practices Speakers Panel, Locally Developed Resources. My name is Sarah Carsley. I'm an Applied Public Health Science Specialist at Public Health Ontario, and I have the pleasure of co-moderating today's session. Before we begin the presentation, I'd like to acknowledge and respect the lands, skies, and waters of Ontario, including for their contribution and sharing to support all life within. I acknowledge and respect the treaty, unceded, and traditional territories of all First Nations across these lands and waters. I would like to acknowledge that I'm in Toronto, on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with the multiple Mississaugas and Chippewa bands. Please join me in acknowledgement and respect of all Indigenous peoples, their life journeys and worldviews. May their wisdom always guide our own path forward with open hands, open hearts, and open minds for the mutual success and benefit of all in Ontario. Lastly, I'd like to acknowledge Daniel Coles, who helped co-author this land acknowledgement, and thank him for sharing it with us. I'll now mention a few housekeeping items. To enhance the presentation experience, participant audio video has been disabled. The chat pod has also been disabled to limit any distractions during the presentation. Please use the Q&A pod if you have questions during the session. A discussion and question period will follow the presentation. If at any point during this session you experience any technical issues, please email capacitybuilding@oahpp.ca. I would now like to introduce my co-moderator for today, Anya Cahill. Anya is a registered nurse with the KFLNA Public Health in the Healthy Babies and Healthy Children and Early Years team. In addition, Anya is the Ontario Parent-Child Relationship Program Nursing Practice Lead with the Public Health Nursing Research Practice and Education Program, P.H.O, through the School of Nursing at McMaster. With 15 years experience in home visiting, she is passionate about equity, working with family strengths, and meeting people where they are. Thank you. Over to you, Anya.
Thank you, Sarah. I'm thrilled to be here today co-moderating with you and representing the work of PHN Prep team in supporting public health nurses, supervisors, managers, and all home visiting staff in their work with families. Today's webinar is really excited. We're going to be hearing from 4 speakers representing 3 different Ontario public health units. We're going to be hearing from Katie from York Region Public Health, Jackie from Middlesex London Public Health Unit, and Angela and Janet from the Haldeman Norfolk Health Unit. The plan here is that each speaker will showcase initiatives that were developed within their local agency to support home visiting staff in their use of the Partners in Parenting education materials, or what we call P.I.P.E. Following this opportunity, there will be time for questions from the viewers that can be answered by the panel. And then before the end of the session, there will be a review of available resources, including instructions on how to access everything from the PHN Prep portal. Many of today's resources will be available for use across the province following the session. Our objectives today are threefold. First, we want viewers to be able to replicate a variety of innovative, locally developed P.I.P.E resources for use in your own home visiting practice. We also want viewers to be able to create or select P.I.P.E lesson strategies relevant to support the development in an identified NCAST subscale or as per the Family Service Plan goals. And of course, to organize the necessary P.I.P.E materials, supplies, and equipment within the various public health agencies. But first, a bit of background on what P.I.P.E is. So P.I.P.E, or as I mentioned, Partners in Parenting Education, it's a curriculum, a set of materials developed by an organization called How to Read Your Baby in Colorado. The purpose of P.I.P.E is to strengthen the relationship between parent and child. It's based on sound educational and psychological research, and it's child-focused. This program uses the expertise of all of the partners in the parenting process, which includes the caregiver, the child, and us as home visiting staff, or as they call them, educators. P.I.P.E interventions are designed to be fun. They contribute to a positive emotional relationship between the caregiver and child. There's 28 topics within the PIPE materials that are organized into 3 units. You'll hear these being referred to as listen, love, and play. The lessons do not need to be provided in any particular order, and not every lesson will be applicable to every family. The selection of the unit, the topic, and the lesson should be informed by the nurse's assessment of the family's strengths and areas for growth, such as through the use of a parent-child interaction, feeding, or teaching assessment. All of the lessons follow this 4-step instructional model that you can see on the screen, and lessons can be completed in about 15 to 20 minutes during a home visit. There's many materials provided by How to Read Your Baby to support these endeavors. This includes an educator's guide, parent handout, and activity cards. And when they're used together, you can develop a lesson plan to be implemented with a family by either the public health nurse or the family home visitor. PIPE was originally introduced to Healthy Babies, Healthy Children in 2012. There was a 2-day training session provided for leads that many health units were able to attend. Since that time, training has been at the discretion of the health unit. So with this brief overview completed, I'm happy to introduce Katie Archer. She's a family resource worker from York Region Public Health to share a set of resources that have been developed there. Over to you, Katie.
Hi, everybody. So yeah, I'm Katie Archer, family resource worker, formerly known as family visitor with York Region Public Health, and I'm here to present our locally developed resource of the PIPE topic summaries. A little bit about the history of how they were created. They did first start in the Ontario Nurse Family Partnership Program, and with permission, we adapted it at York Region Public Health to fit the HBHC program. So what are PIPE topic summaries? Simply put, they are a tool to support the creation of lesson plans for PIPE. And it is important to note that before utilizing the PIPE topic summaries, you should have a fairly strong foundation of PIPE and how to create the lessons. And this is that tool to make it easier and more efficient, ultimately making it more accessible to HBHC staff to incorporate it into their practice. Moving on, we'll talk a little bit about the reasons why the PIPE topic summaries were created, specifically some of the challenges staff were facing in writing lesson plans, and then some of the benefits that the topic summaries bring. So some of the challenges are that resources are in multiple locations. There's the educator's guide, the parent handouts binder, and the activity cards, which are bulky, they take up a lot of space, and they take up a lot of time to go back and forth when writing a lesson plan. There's too much content to go through. So although it is good to review for our own foundational knowledge, when it comes to lesson planning, it can be overwhelming with all that extra material to sift through. It can be difficult to share resources with clients. So in particular, I find the activity cards, clients really do want to copy those, especially if there is a song with specific lyrics. They want to be able to reference it a few times before they have it memorized and are able to incorporate it into their regular interactions with Babe. And that it takes too long to write lesson plans for kind of the reasons explained above. And now, thanks to the hard work of everyone that's been involved to create them, we have the PIPE topic summaries, and we get to reap the rewards of them being all in one location, condensed for easy use. So each topic summary does take the material from the educator's guide, the parent handouts binder, and the activity cards, and condenses it into one document. It's easy to share. So you can simply save or print to PDF the pages of the document that you want to share with the client and send it out there. It's flexible, so it allows you to create a lesson plan and use it in either a digital format or a hard copy format, whatever your preference is. And it allows for customized lessons to be created efficiently. One of the great things about PIPE is that each topic can be presented in several different ways, and this allows us to cater to our individual clients without time being a major burden. So the PIPE topic summaries are available on the portal. So I just want to take an opportunity to provide an example of one and quickly highlight all of the features because you likely haven't had a chance to look at them yet. They just went live. I did choose one topic summary for the purpose of the demonstration, but they are all laid out the same. So this is the first page here. You can see at the top, there's the unit and the topic listed. I didn't highlight or box off this section, but there is an introductory statement included, which speaks to the history of them starting at NFP and who was involved. Followed next is the conceptual overview, which for this topic, it does continue on to the next page. Then there's step 1, the presentation of concepts, in which part 1 is either the inquiry questions or the suggested activity. Continuing step 1 is the key concepts. And also, although you can kind of see it throughout the topic summaries, I did highlight here references to the parent handout. So here, parent handout number 43, and references to the educator's guide. So here, page 88. It then moves on to step 2, demonstration, and step 3, parent-child interaction. And then step 4, evaluation. After that, there's this resources to support implementation. So this is a chart that was created that takes all of the references to the parent handouts and the educator's guide and tells you what it actually is. So for example, before we highlighted parent handout number 43, we can see here that it's the tune in, tune out animal artwork. And we highlighted page 88, which is tuning in, tuning out from the educator's guide. Then there is also the outcomes for the topic listed. Finally, included within the document is all of the parent handouts for that topic, and we've made sure to include the parent handout number in the top right corner just for easy reference, and all of the suggested PIPE activity cards for that topic. So you can see in one place you really have all of the content that you need in order to create that PIPE lesson plan. So ways for you to use it. So based on the preference of the facilitator or the educator, the PIPE topic summary could be used in either a hard copy, a digital, or a hybrid approach. As hard copy, you could simply just print off that summary and highlight the sections relevant to your lesson plan and go with it to the visit. As digital, you could copy the material right from the topic summary and paste it into a fillable PDF lesson plan. And you know, at the end of the presentation, Anya will highlight one that is available through How to Read Your Baby. And hybrid, you might, and then you would bring your tablet or laptop with you for that visit and just have it displayed on your screen. And then hybrid, you might still do that copy and paste approach, but you might print off your lesson plan and have that hard copy for the visit. And then that hard copy digital hybrid approach could also be utilized for the parent handouts and the activity cards. So you could print it off and give it to the client during the visit. You could display it on your screen, or you could give that hard copy during the visit and also follow up with an email copy as well as kind of that backup in case anything gets misplaced. So if you do choose to utilize the PIPE topic summaries, my tip to you is to make it work for you. You all know how you work best, and ultimately the goal is to incorporate PIPE into service delivery with our HBHC clients, and this is a way to make it more accessible. With topic summaries, lesson planning is quicker, which allows us to take advantage of the customizable nature of PIPE and best meet our individual client needs. So thank you. Hopefully some of you might find this interesting and utilize it in your practice with PIPE. And I am done my part of the presentation. I'm going to pass it off to Jackie.
Oh, good morning. Thank you, Katie. Yes, my name is Jackie Allen, and I'm one of the public health nurses with Middlesex London Health Unit. And today I'm just going to share a little bit of the why, what, and how Middlesex London is using the PIPE resources. So when we talk about the why, we have, we really looked at, we're a public health nurse model for the Healthy Babies, Healthy Children program. And though we all work really autonomously as nurses, it was important to us that we had some consistency in program support that we were providing. So, as Katie mentioned, I'm sure we're not alone when we say time is really limited. So, to sit down, go through all of the resources and materials we have, locate them, and put together what you need, that can be a bit of a challenge. So, we looked at what we already had, which included all of those PIPE materials. So, we already had the educator guide, the handouts binder, the activity cards. In addition to having all of the resources, we also had quite a few of us who had completed the PIPE training. So it made sense from a resource perspective, but we also wanted to make sure the resources we are using to support our families were evidence-based, which PIPE is. So it was kind of a good fit on a number of those levels. So when we kind of looked at what we did, we thought, okay, we have this limited time to put together what we need, but at the same time, we're encouraging us to use the PIPE sessions and to implement the programming. So we decided it would probably be useful if we had some strategies and work plans already created that we could really link to whatever family service plan goal or maybe PCI subscale that was identified as needing some growth in. Then we could put the resource and the strategy together in a place that was easy for everyone to access, and they could just take what they needed to go and do the work. So we currently have 41 different strategies or work plans that we have created. We have the accompanying resources with those. So again, you can just take it and implement whatever intervention you have planned. We currently, I think we have 13 listen strategies, 14 play, and 14 love. So we thought about supporting this implementation over the team, and we really have had a lot of opportunity during team meetings to talk more about using PIPE. So we've looked together at what we've created. We've talked about how to use it, also being open to some feedback and questions from the team so that we can all work together, and being available to sit down one-on-one if someone wants to look through things or say, hey, this doesn't make sense, we can do that together. So just trying to make things as user-friendly as possible. And then we looked at, I will be the first to admit this is not pretty, but we are working on it. So we created all of these strategies and we have them in an easy to locate filing cabinet, and we have them simply color coded right now. So all of the listen strategies are in pink, all of the love are in purple, all of the play are in green. We now have labels on these, which we didn't have when I took this picture. I'm sorry. If you pulled out a strategy, so that middle picture there, you would find what you need to implement the work plan as well as the resource. So you need a book to implement. I believe that's the Reading to Baby. And then we also have a drawer with some extras in it if staff need to access any of those extra resource materials. So this is an example of what an instructional strategy would look like. We've tried to keep it really simple. So this would be Reading to Baby, and it's going to tell you what the unit is, what topic, what concept you're going to be covering, what subscale or family service plan goal you're going to be supporting with your family if you implement this strategy. We talk about what you need, how you're going to teach it, what we're going to ask that parent to demonstrate back. And then we have the evaluation feedback and how we want to end that session with the family, all laid out really clearly, just in a simple page, one pager. So for my perspective, I think like the key takeaways are we always have to remind ourselves, and we talk about this regularly, like small amounts of information being regularly provided over periods of time is so much better. And it's just so much more well received than when we provide volumes and volumes of resources or information, because it can be a bit overwhelming when there's too much. So if we just keep it small and keep little bit at a little bit over time, it works well. And I always say some strategies are a better fit for families than others, and that's okay, right? You're going to choose what works best. And the most important thing I always say is have fun with your family. So keep building that therapeutic relationship, sharing the positives with them. It really goes a far way when we think about our role as coaches and mentors and building that relationship with the family. So that's what we like to reinforce for our PIPE programming. So thank you. And I am going to pass it on now to Angela and Janet.
Good morning. I am Angela, the public health nurse with Hull Norfolk Health Unit, and my colleague Janet, who is one of our family home visitors. So we're here to speak about the PIPE and how we implemented it in Haldeman, Norfolk. So this first slide we have as the tool that combines the NCAST that was completed by the PHN to then transfer it to the PIPE activities. And this tool was created by Hastings Prince Edwards Public Health, and it's one that we found worked for our health unit and our staff. So when that communication is completed to the family home visitors, they have created, Janet actually was the lead on creating this list of activity codes and the items that were needed for each lesson. So when she came up with this list, it was like, wait a second, this could combine with another tool that has been available through the NCAST portal to help health units kind of implement the next steps of the PIPE activities. So with this tool, we created the next resource for understanding with each of the PIPE lessons, how that links with the PCI subscales and kind of what the goals are to each of those subscales. When working with Janet, we decided it was best to color code. So a lot of our items from this tool onto the kits that Janet will be speaking about are completely color coded. So then that way, when we know that we're working on a listen activity, that's kind of the yellow kits. And then we have the love as pink and then the play as blue. So with this tool that was laid out here, we have the PCI scales for every subscale on the left. And then we have the PIPE unit. So then that quickly referenced to what units are being used under that subscale, then lead it into the topic and the page to where to find it within PIPE, and then the kit items from the list that Janet had created. And then in the brackets there, you can see that those link to the activity cards. So this has been created. It's available on the portal, so everybody can access it once this webinar is complete and to be able to print and use it. These are kept in the kits to help with understanding that continuity with communication between the public health nurses when they complete the NCAST to then having our family home visitors as the experts in the PIPE activities. So I'm going to pass it over to Janet.
Hi, so our next slide here shows the kits that we made it. Due to our rural setting and having multiple offices within our region, we decided that each family home visitor would have their own tub of supplies. These bins are an easy size to carry, as you can see in the one photo. They're easy to take in and out of our trunks when needed. Each bin contains the reference sheet that Angela had made for us, so we can look at it quickly to see what we need. All the lessons are divided into folders. Each folder contains like either play, listen, or love. And then we have all the activities in the front of the bin. Each lesson contains an educator's copy with the conceptual overview and the lesson plan. And then we also have the parent's guide copy in there, which is, we can photocopy that no matter which office we happen to be in. So we usually just keep that with like a little paper clip so we can pull it apart and grab the sheet we need out of it. This bottom photo kind of shows you how each bag is labeled with the activity and the lessons that we use in the activities. These we couldn't color code because, as you can tell, like the pom-pom activity shown, we have listen, love, and play are all topics that are used with the pom-pom. So these we decided to just give them labels instead of color coding the bags. Our tips and strategies, break it down. Each lesson can take 2, 3, 4 visits to do. Make it simple for the parents. We really learned like the drip, drip, drip analogy that they use in PIPE. With time, you can remove the activities and lessons that you don't use. Like we said, you want to make it friendly for yourself. So if there's a top, like a sheet in each lesson that like I never ever use it, we remove it. It makes the bins lighter and it just makes it easier to grab what you need. And you don't have to use the materials that are listed on the activity cards. For this example here, we have
Easter eggs, we use that instead of popcorn when we do the emotional refueling lesson. We just find that's an easier thing to bring out than popcorn. And yeah, and the Easter eggs are easy to wash if we need to. And another example is you use what's in the family's home. You know, when you're looking at different textures for babies to use, you look at textures in the house, you know, the fuzzy carpet, the soft couch, anything like that.
So one thing that we found here with our health unit is that our family home visitors are the experts in the PIPE program, and we really rely on their expertise to know our community and how it will fit best with each of our communities. So these kits have been really useful for each family home visitor to be able to pull into their practice and to be able to know the family and know what will be best utilized in the home and best received, and the time that it will take in order to implement that strategy along the way while supporting the NCAST programming.
Thank you. Thank you, Jackie, Katie, Angela, and Janet. I loved that. I found it so informative. I think it's really neat. This is, for everyone watching, this is just 3 health units examples of how they've adapted, modified, and tried to make the PIPE materials really accessible. I'm sure there are many, many other examples of this across the province. These were 3 brave volunteer health units that stepped up to say, we have something neat and we're happy to share it. So I can't thank you enough for taking the time to put together these presentations, snap the photos, do the screenshots, and share these resources with the province. I'm really excited now to move on to the Q&A portion of our session. Now we've got time. We've got oodles of time here to field some questions from the audience. And just a quick reminder to everybody watching, if you've got questions, use the Q&A pod, and we will work through them together with the panel. So thanks, everybody. And here we go. First question. We're looking for suggestions on how to introduce the use of PIPE to your families. So in addition to all these novel interventions to ensure you pick the right one, how do you even go about introducing this? Katie, would you like to take that one first?
Yeah, I think that's a great question. So typically during the initial joint home visit, when it's time to explain what my role is and what to expect kind of moving forward, I briefly mentioned PIPE as one of those activities that we will be doing together. And then on the actual day of when I'm going to be introducing PIPE, I'll label it as PIPE, and here's the topic we'll be doing. And I give a really brief explanation of the 4 steps. So I usually say something along the lines of, this is the topic we'll be doing. We'll start with having a little bit of a conversation, maybe looking at some worksheets, and then I'm going to do a demonstration with my baby doll, and then you're going to have an opportunity to play with your baby, and then we'll come back and talk again. And I do that to kind of give that anticipatory guidance of what to expect, and also hopefully to kind of keep it on track, because sometimes without that, I find that we veer our conversation otherwise. So I like to kind of give that sort of breakdown so they know what it is.
Thank you, Katie. Jackie, did you want to add to how you introduce PIPE to families in home visiting?
Yes, I do. Thank you so much. So usually, yes, we like to introduce, we suggest it's best if you can talk about PIPE like right from the beginning of service. So after you've completed that in-depth assessment, we've talked about the family service plan goals, families consented to participate in the program. We really just want to introduce it simply as we're going to be doing activities together to support the goals the family has identified as being interested in, and that's some parenting support. Then when we go to the next visit, it's really nice to just bring that up again, saying like, do you remember when we talked about activities together to build on, you know, whether it was parenting or optimal growth and development, you know, when we talked about doing those things together, well, today we're going to try activity, you know, X to support that and hopefully have some fun together. So just keeping it simple.
Perfect. Thanks, Jackie. Couple of questions coming in are for me here. There's a question in the chat about having permission to share these resources electronically. As we've mentioned a couple of times, that the materials from today are included on the PHN Prep Community of Practice portal, and I will go through some steps on how to access that. But I just want to say, yes, we did, through PHN Prep, reach out to How to Read Your Baby and do have permission to share these materials electronically. So there's some apprehension because when you open up the resources, the first page in size says, you may not record these electronically. But rest assured, we do have permission from How to Read Your Baby to host these materials on our portal. And I will show you how to request that same permission for your own individual agency if you would like to have that for yourselves. But you are free to download these materials and it's with permission granted. So that's one question. There was another here about which health unit Janet Thickens is from. Janet is from Haldimand, Norfolk. So both Angela and Janet work together there at the Haldimand, Norfolk Health Unit. And there was another that I thought was for me. I'll find it again in a minute. We'll go to another question for the panel. How long did it take to acquire the materials and assemble the individual kits? Janet, that might be a great question for you as you showed some pictures of the kits today.
Hi, so ours was kind of like a work in progress. We actually started to put the kits together before we had the training. So it's been a little, interesting. We, as a team, like all the family home visitors, we got together for a day and we took probably a good morning to photocopy all the information we needed. Each person took one section, photocopied it off, and then we, got together and made the folders up. And then it took probably another half a day for us to go out to dollar stores, Walmarts, little stores like that to get all the activities that we needed, like all the supplies, and then put that all together too. So I would say if you're doing it as a team, give yourself a good full day to get it all done.
And one thing that's unique with our health unit is that we've had some changeover over the years of staff. And so when Janet was speaking about kind of creating these kits prior to having the training, is our health unit had some funding that we were able to provide all that training to the family home visitors the beginning of this year. So that just happened January of 2024. Prior to that, we've had some discussions about how to incorporate PIPE. And it was realized from our family home visitors too, that often they are using PIPE by blowing bubbles, but just not understanding the education and the evidence behind it. So now that they've had the training, they understand a lot more of the evidence behind it. It's more intentional now that we have the kits and that system set up within our health unit.
Very good, thank you. There's questions coming up in the chat about the demonstration component. So one of the 4 steps in the PIPE model is this idea of the home visiting staff, whether that's a family home visitor, family resource worker, or public health nurse in the home doing a PIPE lesson, demonstrates a portion of the activity to the family. I'd like to take a minute just to talk about the importance of that demonstration step. Katie, did you want to start us off?
We go once I'm unmuted. Yeah, I think it's really important first to kind of highlight the importance of doing all 4 of those steps and making sure you are doing them in sequence, because that's what the research supports the effectiveness of the program when it is implemented as designed. And really, in my opinion, the way it's designed allows for all different learning styles and learning types to be addressed. But specifically for that demonstration step, I think it's that bridge that allows parents to see those concepts that we just talked about actually in action and kind of gain that confidence to try it with their baby when they see it. And really, like, if nothing else, it's kind of broken the ice a little bit that like I just let them watch me play with a baby doll, sing and talk to a baby doll, that then in return, letting me watch them play with their real life baby hopefully is a little bit less intimidating.
I love that, Katie. I was going to add that I also like the demonstration component and I find it useful because it gives the parent the opportunity to see concretely what you're asking them to demonstrate instead of just using words. So also, as a public health nurse, that's what I think. We're putting ourselves out there. It's nice for the parent to see us being a bit vulnerable and having some fun and being silly. So it creates a nice positive experience all around with the parent. And when we talk about coaching and role modeling, like this is a really important piece if we think about that.
I'm not sure if this is part of it, but one of the Katie mentioned coming in with a doll. One of the things we've been made aware of is we also have to be culturally aware of the people we are visiting. In our area, we do have a culture that if you were to walk in with a doll, they'd be insulted. So we have a family home visitor who's had to kind of work around that, and she does use the child instead of the doll. And she also has to really watch how she says things. She can't walk in and say, let me show you how to do this. She has to make sure she really words it the proper way. So she role models with the child and then points out the baby's reactions to what she's doing. She'll she'll show to the mother or the father, look, did you see how the baby's eyes lit up when I tickled her or when I wiggled the rattle in front of her face? So she's just found her own way of showing it with the parents, how to do it, but still, working in all those little points of PIPE.
Thank you, Janet and Jackie and Katie and Janet. I think we can springboard right off of that. There's a few questions in the chat about the doll. I think the doll does provide sometimes it's a barrier. I think sometimes people might feel a little bit silly. There's a mention of the demonstration with the doll could be distracting, that other babies might be curious and want to play with the doll. Let's have some discussion about the doll in the demonstration component.
Yeah, so I think it is important, as long as it's culturally appropriate, to Janet's point, to utilize that doll, so that initial experience is with the parent, because sometimes the baby's response may be different from our experience with them versus the parent, and that could be damaging to the client's confidence. And then also like like I have experienced, sometimes it is a little bit distracting, especially with like some of the older children with the baby doll. One thing that's kind of silly, I've named my baby. Like I have a name for my baby, so I actually refer to him by a name. I felt like that made me a little bit more comfortable, that it's not just like, oh, baby or doll. It's like he's got a name. I introduce him with that name. So that's something that I've done in my practice. And there's some clients that, like, when I bring him out again, they're like, oh, Marcus is here. There's baby Marcus. So they learn the baby's name as well.
I like that, Katie, and I totally agree. And also like being respectful again of like what Janet identified with different cultures and being aware of that. I like the doll though, because again, building on what Katie said, I always want the first experience of an activity to be between the parent and the child, not between the public health nurse and the child, especially if it can be a bit tricky, right? If the mom isn't confident in her parenting or doesn't feel good about herself, doesn't think she's doing a good job. And then there's always that risk for the little one responding really positive to the nurse and not as much to the parent. So that's not good for the experience. And I feel like we can avoid that if we use the doll. And people get used to you bringing the doll. I agree with what Katie said. It can normalize it over time once we're comfortable and the family understands, the rationale.
Very well said. We have to remember that PIPE really is built on the idea of shared positive experiences, and that shared positive experiences build and shape relationships. So having the doll there, bringing Marcus along, making it fun, that in itself is a shared positive experience that you've had with the family, and just helps to, strengthen and shape and form your relationship with that family. So have some fun with it. One of the questions was about using something other than a doll, and we've got one of our training videos. It's a nurse in the home, and she actually uses her purse and she calls it Percy, and she does the entire PIPE demonstration component with Percy the purse. And it's silly and it's fun, but it's not unprofessional. It's done in a very considerate and respectful way of, I'm going to show you how to do this and I'm going to use my purse to do it. And it just, again, it's a shared positive experience with the family. So I will draw attention to those videos later in today's session. So have a look at, it's Carrie Ann and her bae, Percy, just for some fun ideas. Janet, just in the chat, there was a group wondering what the culture was that was having difficulties with bringing the doll into the home.
We have a huge low German Mennonite community in our area.
Thank you. So that's a very specific culture that may or may not be represented in other health units as well. So viewers out there, you may not have that experience in your health unit, and that's okay too. But it is so important to be humble and aware and inquiring when you're meeting your family. So thank you for that, guys. We're going to move from dolls to documentation. We've got a number of questions coming up in the chat here about how do you document all of this stuff? So we've got different health units have different platforms. The provincial database collection is ISCUS. So if you could each speak to how does your health unit do that? There might be pieces that viewers can pick up and implement into their own health unit.
Yeah, so at York Region, we do document all of our PIPE information in ISCUS. So in our documentation visit notes, we'll have a description of how those 4 steps were implemented. And then from there, with that interaction, we do add an assessment. So we've added PIPE as an option as one of our assessments. And it'll pull up a little pop-up screen with listen, love, play, and a little text box. We fill that out. And I know the reason why we included it as an assessment was for data tracking in terms of the frequency of implementation.
So at Middlesex London, our agency uses A.P.I.E method of documentation for each visit. So A.P.I.E is the assessment, planning, implementation, and evaluation. So for us, we just document it in our electronic records, not in our ISCUS. And so under our A, we would put anything that we, see or hear under our assessment component. Under the P, what we're going to do that day and why. So for instance, supporting the family service plan goal with X. Under the intervention is where we would put the PIPE as what we did that day, what topic, what unit, and what concept. And then under the evaluation piece, we simply put, how did the parent feel about that visit? What do we want them to do before we come back? What's our job? What's our tasks before our next visit? But we don't put any of our PIPE information in ISCUS. It's strictly in the electronic documentation system for us.
For us, we have a family home visitor drop form within ISCUS that we use. And on it, we have like growth and development. And then in there's a drop down button where we have PIPE listed. And then in there's another little drop down button. And we write in which lesson we used and what topic we discussed.
So some of the challenges that we're having is just kind of figuring out what needs to be reported for stats. And as we continue to evolve, all our HPHC documentation is done in ISCUS. Sorry, ISCUS, yeah. Sorry, I was on the ID team for a bit, so I had IFIS on the brain. So in ISCUS, and so as we're kind of figuring that out, we ask a lot of questions of the team and of other health units to be able to evolve with the way that we're reporting.
Mm-hmm. Yeah, because right now, the way that we have, where we're documenting, it's not showing up on anything for the government saying that we're doing PIPE. So that's what we're looking into, is how we can get it to show up there for them.
And then the key part is the communication back with the public health nurses. So then that way they know what was utilized and how the family has responded. So when they do their next NCAST, we can see the impact of the PIPE activities. So those are things that we're still growing through at Haldeman Norfolk here.
Yeah, I I think this is so great. It's one set of materials used in the home visiting program, and we can see how it's documented very differently across 3 health units, in that we do have ISCIS, which collects that provincial level data. But you're right, Janet, as you said, there's not a field there at the provincial level that's collecting that data back for as a provincial level to see. So like in Katie's example, it's a customary assessment has been inputted. So if you're curious about how to do that, ask your ISCIS specialist to connect back with the ISCIS team, because there's ways to get custom assessments into ISCIS and then generate local level reports from that. And Angela, I'm glad that you mentioned about the communication piece, because of course, documentation is important when a registered nurse is implementing these materials. We need to document that according to our college standards of practice. But the communication between team members is really rich and important too. So from the nurse to the home visitor to say, I've done this assessment, or I've made these observations with the family. I think these areas would benefit from support and growth. You can discuss mutually which PIPE activity to select. And then of course you need to hear back from the home visitor. How did that go? Did it get done? When was it done? So the nurse can follow up appropriately with another assessment, but also, was the family receptive? As has been mentioned, maybe it happens over more than one home visit. So did it take a couple? Is there a way that we can make learning this material and picking up these pieces through the drip method even more easy? So I thank you for bringing both of those pieces up. And there's, for anyone wondering, there isn't a set way from the ministry to document how PIPE is done. So find your way and make sure, of course, that you're covering what you need to cover from the College of Nurses, and that you're covering what you need to cover as far as communicating with your team members. But however you get that in there, that's the right way. So thank you all for that answer. And we're going to totally switch gears here and go on to cleaning. We have a number of questions about cleaning, of course, the materials that we bring, disinfecting the doll, basically your infection transmission prevention with reusing materials. So let's have some discussion about that. Katie, did you want to kick us off?
Yeah, I think it's kind of been mentioned before, but first and foremost, we try to use what's available in the client's home. That will kind of eliminate that as much as possible. And a lot of the materials will be available in the client's home. There's not a lot of like out there things on the PIPE activity cards. But sometimes we do have to kind of break out from our little bag of goodies. And if we do, our staff are just responsible to make sure that we're cleaning it in between visits, just using our materials available in our PPE kits.
And yeah, here at Middlesex London Health Unit, we all would follow our agency infection prevention and control outline, which we have for sanitizing any toys or materials. So we already have that in place for our NCAST PCI teaching kit materials. However, again, building on what Katie says, if the family already has an item in their home, whether that's a scarf or a hat or a rattle or a ball, we can just use that. If we have something that's not easily cleaned and we use it, we will just leave it in the home. So if we have a little scarf that's part of the kit, we'll just leave it with the family, and we will replace that in the kit when we update things when they come back. And there are other things that we just simply would not take. So if a Play-Doh container is part of your kit that you've taken out, we're just going to be leaving that Play-Doh with them. But yes, if we can use what's already in existence with the family, that's ideal. But we do have IPAC measures we follow according to our agency guidelines.
Yeah, we kind of follow them. We have a blend of what we do also. We like to use what they have there in the home. We will sanitize with like a 10-to-1 bleach solution. We all kind of do it just in our own homes at this point. I've had it before where I've forgotten I need a toy, the same toy in 2 different homes, and I've used the Cavicide wipes that we have with our baby scales, and I'll like wipe down the toy and let it sit for a minute before, well, longer than a minute, because it takes longer than that to dry from one home to another. So I know it's been sanitized before I bring it into the next home. Yeah, and then we also let them keep it. For an example, crayons. instead of bringing a whole box of crayons in, I'll take 3 or 4 crayons out with the activity, and then the child just gets to keep those crayons there. Yeah, and then the Play-Doh too. We never take the Play-Doh back.
That's great, guys. And I think it's neat to see, like in Jackie's case, at a more urban health unit, all of those materials come back for centralized cleaning. Is that right, Jackie?
Correct. So we already have like the tubs available with the instructions on how to sanitize those. Because if you're using your teaching kit, you have to clean those toys anyhow. And we are mostly urban. We do have some rural as well, but most of us do come into the office a certain number of days per week. So it's available for that to be done at that time.
Perfect. And then that can be compared to Janet, where things are more rural and the nurse may, or the home visitor may not be coming into the office as frequently, that some of that responsibility gets shifted directly onto that person in the home between visits. So again, as long as things are being disinfected and there's lots of cleaning policies out there that are available and instructions on how to cleanse these materials, you're doing it right. One of the questions was specifically about the doll, and I can say we looked at that here at KFL&A and specifically chose, you know, basically bald baby dolls. They have molded hair rather than fibrous hair for that reason. So it's really, the whole baby doll is easily wiped down. So that's something just to think about and keep in mind as you're selecting which type of baby doll you might want to use in your home visiting. Thanks, guys. So let's see, we've got some other interesting questions. There's one here about funding for the cost of the activity materials. I'm not sure if anyone, we're frontline here. Does anyone have an idea of how the funding was attained for purchasing these materials? Nope, nope. Oh, Janet?
I believe we just realized we had a little bit of funding left over at the end of the year. Like, you know, you get this certain amount of funding from the government every year. And so we decided, hey, let's use it to make these kits.
I feel like that might go hand in hand with a question about, do you have any idea how much it cost? Like, I know a number of these materials can be picked up at Walmart, the dollar store, fairly inexpensively. You may not know, and that's okay.
Yeah, yeah, I'm not sure exactly how much we had, but I know it was a limited amount. We really utilized like the dollar stores as much as we could. And yeah, we really made sure we tried looking for bargain deals.
Jackie, did you want to add to that?
I was just going to say, here at Middlesex London, what we did first was we created all of the strategies and then looked at what we could use for most of them. So many of them have like a pom-pom, right? Those aren't expensive. And then we generated a list of the most frequently used that would go across all of the strategies created. And we were really lucky to have, you know, management support who looked at where they could pull some bits and pieces and do a bulk order to get the best cost for the items that we have, as well as some addition to maintain that. But like going forward, I'm not sure, right, where the budget lines draw from. So we'll keep our fingers crossed that as the years go by, it will be okay.
Yep, that's fair. Yeah, and again, we're frontline here, so we don't necessarily know all the ins and outs of the budget. So maybe worth asking your manager or consulting amongst managers on how did you make that happen? With that question is some questions about, is there somewhere, a list somewhere of the contents of the container? Yes, Janet has put together that really great list about which activities use which materials. That is going to be shared on the portal. So you'll be able to download that and use it as a bit of your own shopping list. And like Jackie said, go through and see, oh, pom-poms are used in 6 activities. That's one that we should really highlight spending some money on, versus a rattle is only used once, so perhaps we don't need to buy that right away. So that's a really great idea too, Jackie. A number of questions coming up are regarding both experience and training. So there was a question, someone was curious about how long have we've been using P.I.P.E, and I can say at the provincial level, it was introduced in around 2012. So we're going on 12 years of access to PIPE for the Healthy Babies, Healthy Children program. Now, as I mentioned in the beginning, it was I believe a 2-day session where many health units attended. And then following that, training has been at the discretion of the health unit. And I can add to that how to train your baby does not have like a trainer of trainers model. So we have not been able to certify, for lack of a better word, it leads from the health units like we have been able to do with the NCAST PCI scales. In that material, each health unit has at least one instructor who is a lead on those PCI scales, but the same type of training is not available with PIPE. So we don't have leads in the province to facilitate refresher courses or onboarding for new staff. To be able to use PIPE, the recommendation is to connect with How to Read Your Baby, and they now have virtual or online courses. They're, I want to say, 8 weeks, and they're asynchronous, sort of. They run on a schedule. There are lesson plans, and there's work to be done with a guideline of about how many of the lessons you should get through to come to the culmination of that course. There's some interactive components. You're doing, post feeds and commenting on others' posts and doing some reflection. And it culminates in yourself recording the implementation of the 4 steps of the PIPE process. So it's quite a fulsome experience, given that it's online. You can do it individually and independently, but you really do get quite a rich PIPE experience. So I'm not sure if anyone here wanted to share their own personal PIPE trainings or journeys with the viewers today. No pressure if you don't want to.
Like, I can just add, I think York Region's been using it since 2012, 2013. I only joined the team in 2022, so I've only been doing it for about 1.5 years, and we have kind of a in-house condensed version of a training that is part of our onboarding as staff. So that's where I became familiar with PIPE. So I have not done like the full formal PIPE training from How to Read Your Baby, but have a pretty, I would like to think, a pretty strong foundation and able to implement it with that.
I would add that at Middlesex London as well, since 2012, the PIPE has been in existence here. What is new is that the public health nurses are the ones who implement it now. So a good number of us completed the training, which I found very comprehensive. And it does reinforce the importance of each step of the implementation using a PIPE strategy. Sometimes what I found is it can actually be really overwhelming when you've done the training, because we had used the PIPE. I had used the PIPE before I completed the training, and I felt pretty good about it. And then you do the training and you're like, wait, am I implementing all of these pieces correctly? So it just reinforces the importance of really looking at the concepts and why we're supposed to use it in the manner we are to use it. So it was helpful for that. But also I've heard from others that it can be a lot at the same time, and that you felt good using it before and then you question yourself after. But so yes, as public health nurses, we have completed the training, the 8-week program, and then we implement it.
I believe we started in 2013 or 2014 using PIPE. I know it was shortly after I was hired here, but we didn't have the official training either to start. And like Jackie, I thought, wow, I'm doing amazing at this. And then this past year when we got the training, I realized how much we actually were doing, or I personally was doing wrong. I would bring up the whole lesson and try to like just spew everything out at the parent all at once. So the training I did find very helpful with finding out like the drip, 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 only a little bit at a time. Just give the parents a small amount for them to be able to figure out how to do it, and then come back over and revisit the lesson over and over. I really found that helpful. That said, I did find the training very long. We did it as a team together, which I found very, very helpful, because then you have your teammates to bounce ideas off as you're doing the training. So if as a health unit you haven't done the training yet, I do really strongly say get together in a room where you're all doing the training at the same time.
That was really helpful for our family home visitors to really support each other through the training, and all that learning opportunity, and then to provide some consistency too of what will this look like when they unfold it into the community, as they went along.
That's great, everybody. Thank you for sharing that. Lots of good ideas there. Lots of ways to make this really doable across the province. So thank you. Let's see, we've got a question here about how do you explain to families why you brought a specific topic? Is there a way that you introduce things to help, sort of guide why did you choose this and why are we doing it today? Does anyone want to take a go at that?
I do a lot of parent guided education. So a lot of times the parent has brought up a question about a topic first, and then I'm like, hey, we've got this lesson on that if you'd like me to bring it out. We're still in the process of having the nurses do the NCAST and then tell us which lessons to take out. So yeah, I really like to base it on questions the parents have asked and then go from there.
I like that too, Janet. And one of the things, we have already done family service planning at the very beginning of the relationship. So it ties right back to that. So just going back to, oh, remember when we first did those goal cards and you said it would be really, you were really interested in, learning how to communicate with your baby better. This activity is really keeping it as simple as possible, not making it, like, oh, you really need some growth in this subscale. So that's why I'm bringing this out, right? It's not, this is what the parent identified as something they were interested in. And so we're bringing something that would hopefully be useful to them in that manner, keeping it.
Yeah, I don't think anything new to add, really, just based on the family service plan and what the parents have identified as interest.
Yeah, that's a really nice part about the Healthy Babies, Healthy Children program is it is so family directed. You're really always working on things that the family has identified an interest in. So it helps to make a great segue into introducing these different types of activities. So great job, everybody. Let's see, we've got a question about willingness to share the PIPE instructional strategies. Yes, again, all of the materials that are shown today will be available on the portal. So that does include the PIPE lessons that Katie went through that were originally developed for NFPE and then since modified for Healthy Babies, Healthy Children. Those are all up on the portal, as well as the Middlesex London developed specific strategies for lessons. So those are all up there too. And the Haldeman Norfolk, that kit list, the color coded, how do you choose from a subscale which intervention to do? So all of those materials up there, and the Hastings Prince Edward really neat chart roadmap. And if you need any help in how to use it or interpret it, I do encourage viewers to connect with the NCAST PCI instructor at their health unit, because that material has been looked over by that group, and your instructor might have a bit more of an idea on how to kind of follow the one into the other to pick the right thing. So it's a really, really neat tool that helps to identify exactly which PIPE strategy to use with the family in support of their goals. So that everything is going to be on the portal, so no worries. And if you find that something's not there that you're hoping to find, just connect with me and we'll make sure that you can find the right way. While we're talking about the portal, there were some questions in the chat too about who can access. The PHN PrEP community of practice really was founded to support public health nurses, and particularly with a focus on those doing home visiting. But it's really quite broad. We understand this is a blended team. So I will say it's really up to the manager supervisors of the different programs to make the decisions about which of their staff or team members should be accessing that platform. So if you're curious about getting access or logging in, do connect with your manager or supervisor to advocate for yourself on why you feel that you might want to access the resources there. and they can make the informed decision for what's best for their team at that agency. I will, at the end of the presentation, go through how to request access and then how to do your first login. So no worries, we are not trying to keep these a secret from anybody. We want to make sure everyone can access. So the materials will be there and will help you get logged in. Question about the kits. We love going back to the kits. It's a question about the home visitors, and I think it's specifically to Janet and the big box. Do you take those kits to every visit or just take in what's needed for that particular session?
Yeah, so I keep the kit in my trunk and I just pull out the activities I need to take into the home. The reason you want to be able to get in and out of your car is because grocery day, you want your car empty. And it's good to be able to bring the kit into the office when you want to like top up all your supplies.
And Janet's
Perfect.
also shared an experience in the past too about the intent of maybe doing one activity and then realizing that there's another activity that the family needs a little bit more of that session. So having the kit in the vehicle provides that easy access to, okay, no problem, we can switch gears and just be present for where the family is that day.
Well, that's ultimate flexibility there.
Mm-hmm. And the fact that
Right.
we're rural, right? So being a rural community, it's nice to have those at your fingertips, but the whole kit does not go in to overwhelm the family.
Would be like bringing in a toy box. You would never get everything back in there again. Good. Jackie or Katie, did you want to add? How do you pick which materials to bring into the home?
Like typically I would have the lesson plan prepared in advance and have just materials that are reflective on the PIPE activity cards. So
That's kind of been the goal here with that grab and go kit, is that you already know which area, which family service plan, or which subscale you're wanting to support. So you could take more than one if you wanted. We have multiple copies so that you can just grab and go, so that not if one nurse took it and the other one can't go, well, now I can't do that. We have multiple copies, and we've just done a review of which ones seem to be used the most. So we're going to make additional copies of those. So yeah, they're just prepared and ready to go.
Perfect. And we've mentioned a couple of times about the difficulty with sanitizing some materials like Play-Doh, like crayons. So those are smaller and inexpensive and can be left behind in the home. A couple of times the question about addressing the safety of leaving these materials behind in the home has come up. How do you share that with families? I'm going to leave you this, but there could be some safety concerns about these materials. What do you do?
We do have a safety committee here. We've all gone to a workshop about like the safety of toys. So we make sure that any of our products that we have in the kit, we try to make sure follow those safety standards ahead of time. But yeah, if there's something where we think like you have a 4-year-old and a 1-year-old and the 1-year-old's going to eat the Play-Doh, we do bring it up about, make sure that you keep it in a safe area away from the baby. So yeah, we do kind of talk about the safety concerns with the parent if we're leaving something behind.
Perfect. Anything to add, Katie or Jackie, or that pretty much covers it? Okay. Yep. So just reminding and refreshing on the safety of those materials, and of course, encouraging adult supervision when those materials are out. A few questions coming in about the PIPE curriculum and it feeling maybe a bit out of date. Some of the manuals are showing publication dates of 2002. There were some updates when Ontario came on board with PIPE. They did, I want to say update, augment, refresh a few of the handouts so that they were in line with our BFI principles at that time. So there was a sort of interim update that occurred, but nothing since. So if you feel like my materials are old and I've missed an update, you have not. What you have is the up-to-date material. When I have spoken with How to Read Your Baby about what's coming next, their direction has been on updating all of these written papers into electronic formats. So we're waiting for that to come out. I don't have a date. If I had to throw one out, I would say within the next 5 years. They're a small group over there at How to Read Your Baby. And I'm hopeful that when we see the announcement about a move to an online platform for these materials, that it comes with a refresh and perhaps an update at that time. But at this time, no, the curriculum that you have is the most up-to-date curriculum. So rest assured. Then there's a couple of questions here for Jackie. There's some specific questions about the public health nurses. Why are the PHNs implementing home visiting? Do your PHNs do both NCAST and PIPE? And I'll let you explain that one.
I can, yes. So we are a PHN only model, which means we are responsible for implementing everything. We don't have family home visitors within our health unit at this time. So yes, we are responsible for all of the case management, all of the assessments, all of the interventions that we choose and implementing everything. So did I miss anything there, Anya?
I don't think so.
No,
Yep.
yeah, it's our role. It's our role to deliver the entire Healthy Babies, Healthy Children program, including the parenting aspect. So, yeah, it's been working. I feel like it's working quite well within our health unit.
Perfect. While you're on, don't mute yet. There's a question about expanding on the goal cards. Can you talk to those?
I'm sorry. Expanding on.
So
Does
the
that mean the
question,
family service plan goals? How that fits with the strategy?
well, we'll have to ask the individual who asked that question maybe to give us a bit more information. The question
Okay.
just said, could Jackie expand on the goal cards?
Shh.
We'll wait for that one to come back.
Okay,
No sweat,
thank you.
Jackie. Okay, let's see what else we have here. So I think that gives a good answer. There have been some questions about this blend of who's offering which strategies. And so it does depend on the format of how your team works within your agency. So there are many blended teams that implement home visitors with public health nurses and some that are PHN only. And in the NFP program, you again would be NFP only. How interventions are selected is really through that dialogue that Angela mentioned earlier, the communication between the public health nurse and the home visitor, if there are multiple people in with the family. So selecting that way. And yeah, using ones that you feel that are within your scope and are a good fit for the family. So no worries there. And let's see, there's a question for you, Katie, about onboarding training was provided at York. Was that virtual training?
Yes, it was a virtual training.
Okay. So you may get some knocks on your door about where that came from and if it can be shared. So heads up.
Yeah, I wouldn't be able to speak to it anymore. That'd be above me, but
Fair enough. And we have just time, I think, for one more question. And then I do want to share some resources before we end today's call. And I'm just trying to, there's lots. The rest that we didn't get to today, we will answer off air. Let's see, there's one about how often do you go back into the homes to really chip away at the tasks? How long do you typically work on the goals? There was another similar question about how many of these PIPE strategies are you doing with a family? That may be one a bit tricky to speak with because every family experience in the home visiting programs is so varied that families come with such different backgrounds, different needs, various strengths, and various risks and challenges. So how goals are selected is so individualized, and again, based on the nurse's assessment. And how long they stay in the program is so individualized because they may only have capacity to be in for a short time, or they may have a continually changing situation that keeps them in the program for quite a while. So I wish I could give some numbers out there, but I really can't because it just is so varied per family. I don't know if anybody here has a different response or has a minimum or a maximum or some rules that they put around their PIPE that group might be curious about.
Anya, I was just going to go back. I wonder if the person meant I said family service plan goal cards. So according to the HBHC guidance document, you know how it lists out the 17 optional goals for the family to be working on to make those a bit more user friendly. We literally have a picture card with that title on it that we use as we discuss, client-centered care, and we want the program to be what the family is interested in, not what I think they should be doing. So we use those along with a color coding system, and we kind of do it as a game, like green I'm interested in, red I'm not, kind of, and then we literally look at each family service plan goal, and the family chooses which goals they want, and we put them in the pile, and that's how we determine it. In terms of revisiting the goals, we every 6 to 8 visits, we're going to sit down and we're going to go through that again, those goal cards, and say, hey, this is, and check in, like, where are we at with these? How have we been progressing? And then we might close some of those goals if they've completed that, or we might continue on and say, okay, we're going to continue working on that. And PIPE is part of the resources implemented. It's just a part of it. It's not everything that's completed, right, during the visits, because the public health nurses have lots of different assessments and interventions they are also using. It's just one set of tools that we have that we're encouraged to use.
That's perfect, Jackie. I really thank you for bringing that up, and it might even be a good closer for our Q&A here, in that PIPE is just one of many tools in both a family home visitor, family resource worker, public health nurse's tool bag. It's one way to support these really positive connections between a caregiver and their child, but there are others out there, and different agencies use different suites of tools. So don't feel like PIPE is the only one. It's not the answer to all of the things that our families present as items they'd like to work on. And that was a bonus feature from Jackie today. You also got a really great tip on how to discuss and select goals with families. So thank you for bringing that on board, because that is it is a challenging conversation sometimes to have. And it is so important that families know why are they in the program and what is it they're working on, and that those concepts come from within them. So bonus material here from Jackie. Okay, so again, other questions we didn't get to in the chat, I'll follow up with, but I do want to share some resources in addition to the materials discussed here by Jackie, Katie, Janet, and Angela. Those are now in files on the portal by their health unit. There's also another file on there of materials from How to Read Your Baby. If we can just share screen again. Perfect. So here's our first one. Again, it comes from How to Read Your Baby. It's a worksheet for planning a PIPE session. So this is a fillable PDF. I want to say when you're new, but not even, just as you're developing your PIPE lesson plan, you could use this type of a PDF to fill in, again, the outcome that's anticipated, the concept, what materials you need, and then there's boxes for each of the 4 steps. So just 3 are on the screen because the whole thing doesn't fit, but all of the boxes are there, as well as the kind of conclusion and evaluation piece. So I know what Katie has mentioned she can do is take from those York materials that she shared and kind of highlight, click and copy, or drag and drop concepts and strategies right into this fillable PDF to develop a specific PIPE lesson plan. So that's on the portal. Next, we have a PIPE fidelity tool. So this is a bit of a checklist, completely optional. It's been designed by How to Read Your Baby as a personal self-reflection, or it could be used as an observation tool if you were watching someone else lead a PIPE session during your training, for example. The idea behind this resource is to help identify areas of strengths and challenges in presenting a PIPE session. So following this will really help to ensure that all 4 steps of the model are present and promote that fidelity to the original intention of the PIPE instructional strategy. So again, that comes directly from How to Read Your Baby and is available on our portal. Then we have here a self-reflection tool, and it's optional. It's something that you might use after implementing a PIPE lesson plan with a family in the home. If you had some time and you wanted to come back in the car, in the office, at home, and really go through what went well, what didn't go so well, what did you forget to do, what would you do next time? that can help with your own personal self-reflection on using these materials. And again, here is a PIPE implementation tool. This is how to read your baby's most recent addition to their suite of shared tools. Again, it's a fillable PDF, and it outlines your plan to practice these sessions, building confidence and competence to facilitate PIPE instructional strategies. It's really to help facilitators to stay on track with their implementing PIPE. So please do have a look at those materials on the portal if you find them useful for your practice. A couple other things I want to share just in our last couple of minutes here is a resource here that you may be familiar with. It's been developed by Niagara Region back in 2013, and it was funded by the Ministry of Children and Youth Services to support healthy babies, healthy children in the adoption of the Partners in Parenting Education. So it's called a user's guide. The purpose of the guide was to support the use of this program, and it provides an overview of PIPE, how it aligns with other aspects of the HBHC program, and again, practical information on how to use it within the scope of our home visiting program. There's working knowledge of HBHC, basic knowledge of PIPE, and all of the materials available there. So a collaborative approach between the family, the public health nurse, and the family home visitor, focusing on strengths of the family is emphasized. So there's also guidelines for documentation and evaluation within this manual that are suggested. So thank you, Niagara Region. It's been a well-used tool, and I just want to make sure that everyone is available. So that again is available for download on the portal. My last piece here today on additional materials is this set of videos, and they're staff education videos. So not for sharing with families, they're not client-facing, but they're staff education. They were developed in about 2014 in a partnership between Chatham-Kent Public Health and KFLNA Public Health. And they are, this particular one is the Partners in Parenting PIPE instructional video. It's 23 minutes long, and it does go through 3 lesson plans in a home visiting setting. So if you have the chance to pull this up, you'll get to see reading to baby, emotional refueling, the journey into yourself, and baby's first teacher, teachable moments, sort of live and in action with home visiting staff and families in the home. We'll share the link for that. It's not up on the portal yet because I'm trying to figure out the best way on how to share a link to YouTube. But I also want to mention there are videos along from the same series that support viewing in-home use of the parent-child interaction scales. There's one for both feeding and teaching. There's also a video on the promoting maternal mental health materials where you can see, again, home visiting staff using the materials right in a family's home. So just highlighting those little bits. Now, our last couple of minutes is on how to access these materials. So we've mentioned a few times that they're available on this portal. What's the portal? It's this. It's the PHN-PrEP, or Public Health Nursing Practice Research and Education Community of Practice, or on the portal it's called a group. So it's a pre-existing portal, so you may have access already. The point or the purpose, the goal of it is to be a conduit of information and information exchange for home visiting staff. So you access that here by if you can't already access it, and you can try that by seeing that link there in the middle, community.phnprep.ca. If you click that, it brings up the sign-in box there on the right. If you've got access already, you can use your email address and password, and you'll find the materials already. If you need to get access, just contact phnprep@mcmaster.ca and request to have an account. So what will happen then when you email them is you will receive an email back that tells you to go ahead and use it. Now you need to make sure to have phnprep@mcmaster.ca sort of authorized by your IT department. Sometimes those emails get deferred into the junk mail or blocked. So make sure that your IT has @mcmaster.ca as a safe sender. And then you'll go into the portal here at the page you see on the right. And what you'll actually click is the forgot password setting. And then that's how you'll be able to get in using your email address once PHN Prep has added you. If you have any problems with it, just reach out and we'll make sure that everyone gets connected as appropriate. And lastly, I know there's going to be some questions about how do I get permission to share these materials electronically. This form is also available on the portal. It comes directly from How to Read Your Baby. The office manager there is Brittany Holt, and she's shared this request form. So if at your agency you'd like to be able to upload electronic versions of the P.I.P.E parent handouts and other materials, you can do so. The activity cards was a separate permission. They don't often grant permission to share the activity cards electronically, but they did grant us that because of the nature of the home visiting that we do. And we do have some office-less agencies where people really are working, their office is virtual. So we do have the permission for that, and you can absolutely request the same. So Brittany's email address is there. If you want to make that request, she can send you the form, or you can download the form from the portal and ask to have that for yourselves. So lastly, I would just like to thank everybody for tuning in today and sharing this really neat opportunity to dig deeper into, again, it's just 3 of our local public health units that have really taken innovative approaches to supporting their staff's use of the P.I.P.E materials in their home visiting programs. So thank you, Jackie, Katie, Angela, and Janet for presenting. Thank you, Dr. Sarah Carsley, for co-moderating with me. Thanks everyone who joined today's PHO webinar. Now, as always, you can expect to receive a brief and anonymous survey for today's session. Please, please, please do complete this for us. It helps to improve our programming. We're always curious to hear about what you thought. Again, access to a past presentation and to see what's coming up, you can find those on the PHO website under the Education and Events and click on Presentations for recordings. This recording will be shared by PHN Prep directly, as it was a closed session today. We're all healthy babies, healthy children, NFP families on board today. So you'll receive a link to that recording directly from PHN Prep when it's been made available. So again, thank you everybody for a fabulous session today. Your participation was outstanding. We've learned a lot. I hope you have as well. Have a wonderful day.